Hiatal hernia. Definition of hiatal hernia. A hernia occurs when part of an organ goes through an opening in the muscle wall around it. Hiatal hernia is a protrusion of part of the stomach through the hiatus of the diaphragm and into the thoracic cavity. The diaphragm is the muscle between your stomach and your chest. In hiatus hernia, the top part of the stomach gets pinched. Stomach acid can back up through the opening and may cause heartburn and other symptoms. There are two types of hiatal hernia. They are sliding hiatal hernia. This type of hiatal hernia is most common. It happens when part of the stomach and the place where the stomach and esophagus meet slide up into chest through the opening. Paraesophageal hernia or rolling hernia. This type of hernia is less common but can be more serious. It happens when part of the stomach pushes up through the opening into the thoracic cavity and is next to the esophagus. Causes of hiatal hernia. It is not always clear why hiatal hernia happens. But a hiatal hernia might be caused by age-related changes in diaphragm, injury to the area, for example, after trauma or certain types of surgery, being born with an unusually large hiatus, persistent and intense pressure on the surrounding muscles, such as while coughing, vomiting, straining during a bowel movement, exercising or lifting heavy objects. Risk factors associated with development of hiatal hernia includes age 50 or older, overweight or obese, pregnant, smoke. Pathophysiology of hiatus hernia. There appears to be three predominant theories regarding the development of hiatal hernia. 1. Increased intra-abdominal pressure forces the gastroesophageal junction to move upwards into the thorax. 2. Esophageal shortening displaces the gastroesophageal junction into the thorax. 3. Widening of the diaphragmatic hiatus in response to congenital or acquired molecular and cellular changes in muscles or the connective tissue of the diaphragm. It facilitates the migration of the gastroesophageal junction into the thoracic cavity. To date, no single theory proves to be the definitive cause of hiatal hernia formation, and its pathogenesis appears multifactorial. Clinical manifestations. In many cases a hiatal hernia has no symptoms. Some people do have symptoms like burping, feeling nauseous, vomiting, backflow of acid or stomach contents into the esophagus or throat, heartburn, regurgitation, trouble swallowing. Paraesophageal hernias may have more severe symptoms. These can include having trouble swallowing sometimes, most often with solid foods, feeling full after eating only a small amount of food, belly or chest pain, abdominal bleeding, blood loss anemia. In some cases a paraesophageal hernia can lead to a medical emergency. The stomach or abdominal organs may turn or twist, causing very bad pain. There is a danger that the stomach's blood supply may be cut off. This is an emergency, likely needs surgery. Assessment and diagnostic findings. The nurse will perform a physical examination and collect history of the patient. Chest X-ray and esophagogastroduodenoscopy may also be performed to diagnose hiatal hernia. Esophagogastroduodenoscopy is a test uses a thin lighted tube, called an endoscope. The tube has a camera at one end. The tube is put into mouth and throat. Then it goes into esophagus, stomach, and duodenum. Your healthcare provider can see the inside of these organs. A barium meal test is used to check esophagus, stomach, and the duodenum. The patient will swallow a metallic fluid called barium. Barium coats the organs so that they can be seen on an X-ray. Esophageal manometry is another test used to check the strength of esophagus muscles. It can see if the patient have any problems with swallowing. A small tube is put into the nostril, then into throat and esophagus. This measures the pressure that your esophagus muscles make at rest. Most people with a hiatal hernia don't experience any signs or symptoms and won't need treatment. If the patient experiences signs and symptoms, such as recurrent heartburn and acid reflux, he may need medication or surgery. If the patient experiences heartburn and acid reflux, doctor may recommend medications like antacids, H2 receptor blockers, and proton pump inhibitors. Antacids like aluminum hydroxide helps to neutralize stomach acid. H2 receptor blockers reduces acid production. For example, cimetidine, famotidine, and ranitidine. Proton pump inhibitors are stronger acid blockers than H2 receptor blockers and allow time for damaged esophageal tissue to heal. Over-the-counter proton pump inhibitors include lansoprazole and omeprazole. Sometimes a hiatal hernia requires surgery. Surgery is generally used for people who aren't helped by medications to relieve heartburn and acid reflux, or have complications such as severe inflammation or narrowing of the esophagus. Surgery to repair a hiatal hernia may involve pulling the stomach down into the abdomen and making the opening in the diaphragm smaller, or reconstructing an esophageal sphincter. Surgeon may insert a tiny camera and special surgical tools through several small incisions in the abdomen. The operation is then performed while your surgeon views images from inside the body that are displayed on a video monitor. Sometimes surgery is done using a single incision in the chest wall. Thank you. Hiatal hernia. Definition of hiatal hernia. A hernia occurs when part of an organ